Hey everyone, today we're going to tackle something absolutely fascinating. We're talking about what happens when a baby is born with a tiny hole in their heart. It's actually one of the most common birth defects, but it can completely reroute how the body's most critical plumbing works. We're going to break down exactly what these congenital heart shunts are all about. So let's just dive right in. It really all boils down to this one simple but incredibly important question. What actually happens when those intricate walls inside the heart just aren't perfectly sealed? Well, to understand the problem, we first have to appreciate how the system is supposed to work. So I want you to think of a healthy heart not as one single pump, but as two totally separate pumps working side by side. They each have a different job to do, and this is the crucial part, they operate at completely different pressures. This pressure difference, it's the key to this entire story. Okay, so on one side, you've got the left heart. This is the powerhouse. It's a high-pressure system, and it has to be strong enough to push that oxygen-rich blood all the way to your brain, down to your toes, and literally everywhere in between. Then you've got the right heart. Its job is, a lot more chill. It's a low-pressure system because it only has to pump that used oxygen-poor blood on a super short trip right next door to the lungs. So high pressure on the left, low pressure on the right. Just lock that in. All right, we've got our perfect system. Now, let's throw a wrench in the works. What happens if a hole, what doctors call a shunt, suddenly connects these two separate circuits? Well, blood, just like water or electricity, always follows the path of least resistance. So that high-pressure blood on the left side sees that hole and says, hey, an easy way out, and it takes a shortcut over to the low-pressure right side. That's what we call a left-to-right shunt. And the big problem here is that you have perfectly good oxygenated blood that should be going to the body, but instead it's just taking a wasteful, pointless trip back to the lungs. To really understand the consequences, let's follow the flow of the single most common defect of them all, the ventricular septal defect, or VSD. It makes up something like 30% of all these cases, and it's the perfect example of the crazy domino effect that this one little leak can set off. Okay, so here's the play-by-play of that chain reaction. First, that high-pressure blood shoots from the left ventricle over to the right one. This means the lungs get absolutely flooded with way too much blood. The technical term is pulmonary plethora. But all that extra blood has to go somewhere, right? It all drains back into the left side of the heart. This creates a massive problem called volume overload. The left heart is now doing double duty. It's pumping the normal amount of blood the body needs, plus all that extra blood that just took a detour. Over time, that constant strain makes the heart muscle get bigger and overworked. Now, all this internal chaos doesn't stay a secret for long. It starts showing up on the outside. For a little baby, this kind of overload is like running a marathon 24/7, and it shows up as what doctors call the 4 Fs. First F, feeding difficulty, because it's just too exhausting to eat. Then fatigue and shortness of breath. You'll also see forehead sweating, even when it's not hot, just from the sheer effort of staying alive. And all of this leads to failure to thrive. Basically, the baby isn't gaining weight like they should. And as if that wasn't enough, there's one more thing. Those lungs, being constantly wet and boggy from all the extra blood, become the perfect breeding ground for germs. So another huge red flag is frequent, recurring chest infections. Now, for a while, the body can handle this. It can compensate. But if that leak is big and it's left untreated for too long, the body's own defense mechanisms can backfire and trigger a catastrophic crisis, a point of no return. It's actually kind of tragic. To protect themselves from the constant flooding, the tiny little arteries in the lungs start to clamp down and tighten up. It's a defense mechanism. They're trying to resist all that extra blood flow. But here's the problem. As they squeeze tighter and tighter, the pressure inside the entire lung system starts to climb and climb and climb. This dangerous condition is called pulmonary hypertension. And you know what's amazing? Doctors can actually hear this happening. You know the normal lub-dub sound of a heartbeat? Well, that dub sound is the pulmonary and aortic valves snapping shut. When the pressure in the lungs gets dangerously high, that pulmonary valve slams shut with incredible force. It creates a loud, sharp sound that a doctor can hear, a huge warning sign that things are getting critical. And this brings us to the final, terrifying stage where everything flips on its head. The pressure on the right side of the heart keeps rising until it actually becomes higher than the pressure on the left. And now, the shunt reverses. Deoxygenated blue blood from the right side is now forced through that same hole over to the left side, where it gets pumped out to the entire body. The child turns blue. This reversal is called Eisenmenger syndrome, and it is the point of no return. The damage to the lungs is now permanent and irreversible. So the VSD is the most common version of this story, but it's not the only one. There are two other really common defects, atrial septal defects and patent ductus arteriosus. The leaks are in different places, but you'll see the fundamental story is pretty much the same. Let's just quickly compare them. A VSD, as we know, is a hole between the bottom chambers, the ventricles. An ASD is a hole between the top chambers, the atria. And a PDA is a little leftover blood vessel from when the baby was in the womb that connects the two main arteries leaving the heart. Now, the location changes things a bit. Because an ASD leak happens earlier, it tends to overload the right side of the heart more, while VSDs and PDAs hammer the left side. And get this, doctors can often tell which it is just by listening. A VSD has a harsh sound, an ASD has this unique split sound, and a PDA has a continuous whoosh that sounds just like machinery. And here is a wild little detail about the PDA. If that shunt reverses, it causes something called differential cyanosis. Think about the plumbing. That PDA vessel connects to the aorta after the arteries to the head and arms have already branched off. So that deoxygenated blood only mixes into the flow going to the lower body. The result? You can have a baby with pink hands but blue feet. Isn't that incredible? Okay, so with all these really serious risks on the table, the big question is, how do doctors actually find these holes? And more importantly, how do they fix them before it's too late? Well, they have a pretty slick toolkit. A chest x-ray can give them a hint by showing if the heart's gotten big or if the lungs look congested. An ECG can show which side of the heart is under the most strain. But the absolute gold standard, the definitive tool, is the echocardiogram. It's basically an ultrasound for the heart. It lets doctors see the hole, measure it exactly, and, most critically, measure the pressures to see how close they are to that dangerous point of reversal. And the goal of all of this is crystal clear. You have to close the hole before the pulmonary hypertension becomes permanent, before the damage is done. It is a true race against time. And today, the ways we can do this are just mind-blowing. For a lot of these holes, they can do a catheter-based repair. They thread a tiny device through a vein in the leg, guide it all the way up into the heart, and deploy it to plug the hole, no massive surgery required. For bigger or more complicated defects, of course, open heart surgery is still the answer, where a surgeon can go in and patch the hole directly. Which really leaves us with this one powerful thought. When you understand this whole chain reaction and you have these incredible tools to see the problem and to fix it, you can take what was once a life-threatening tragic condition and, with early detection, turn it into just a minor, corrected chapter in what can be a very long and very healthy life.